Next, join me in welcoming our final headliner, Dr. Céline Gounder, Editor-at-Large for Public Health for the KFF Health News and CBS News medical contributor, in conversation with Cheyanne Daniels from The Hill. Welcome back.
Thank you. Doctor, thank you so much for being here with us today. I want to start off, when I was speaking with Dr. Gerberding, we were having a conversation about trust and how we build trust in between our medical and science communities and our particularly communities of color. But one thing that we have seen coming out in recent years is disinformation. And you yourself experienced medical disinformation with the death of your husband. And I want to ask first how you are holding up, how that disinformation impacted you, but then how disinformation and conspiracy theories impact the ability to build trust with other communities.
Yeah, so Saturday will actually be the 1-year anniversary of his death. And so it's very much on my mind at the moment. When he passed away a year ago, I knew that one of the first things that was going to happen was that was going to be used and weaponized by people wanting to spread conspiracy theories about the COVID vaccines. So I had served on the Biden-Harris Transition COVID Advisory Board, was obviously speaking publicly about COVID vaccines, and my husband, being the wonderful, supportive spouse that he was, would support that messaging himself in his community. And I was very much in sort of crisis management mode after informing my family of, I know this is going to happen because this is what happens, this is the playbook, and we need to address it right away. And so I fortunately got a lot of support from the administration to get him flown back so we could get an autopsy done here in the United States. They ensured chain of custody of his body and personal belongings. And then the New York City medical examiner was also very gracious. Normally they don't do autopsies if you don't pass away in the city limits itself, but they did the autopsy for us anyway. And we were able to put out a statement just a couple days after his passing, which I thought was really important because to let people know, here's the cause of death. Of course, I wanted to know myself. My husband was only 49. He had just turned 49 when he passed away. And, you know, I, as a physician, was wondering, did I miss something? Could I have done something? And so partly it was therapeutic for me to know what it was, that it wasn't something that we really could have picked up earlier, could have done anything about in the absence of knowing the diagnosis ahead of time. And it was also really important to get out there that this was unrelated to COVID or COVID vaccines. And initially that did tamp down the disinformation. But then many of you will remember Damar Hamlin had the cardiac arrest due to commotio cordis on the field. And that kicked things up again. So basically every time there's been a sudden death, in a quote, sudden death, among young, seemingly healthy people, it has kicked up that same disinformation about my husband. And I have been challenged by some of these people, just like Peter Hotez, one of my friends and colleagues, to debate some of these folks. The problem is you don't debate what is true or not true. I mean, that's just not how you arrive at facts, right? And I think there's a real misunderstanding that it's not about rhetoric. That's not how you arrive at the truth. And so I declined all of those challenges. But you know, it has been challenging because to have to manage all of that along with just, you know, losing my husband was very hard.
Yeah, carrying on. How, when we see disinformation like this, and as you mentioned, we see it crop up every time a supposedly or seemingly healthy individual has a sudden death or health scare, how does that then impact your profession of being able to encourage individuals to see a healthcare provider, get the vaccines that they need, or even continue working with an administration that is pushing for those same things?
The way I approach working with patients, and I still do see patients a little bit of the time, but also people in the community, whether that might be a community health board or on television or in my writing, I think the most persuasive thing is to show that you care. And it's less about the facts, frankly. And I'll give you a couple examples here. A very good friend of mine is a relative of Leticia Draza, who's the health commissioner in Baltimore. And this is probably December, January, when the vaccines were just getting started to be rolled out. Her mother-in-law is high risk for COVID, and especially at that time since she wasn't yet vaccinated. And she was resistant to getting vaccinated. And so I was just curious, what was her thinking? What was her logic? I wasn't really going into the conversation wanting to convince her. So we probably spent about 45 minutes just talking. She lives in Baltimore City. She works as a security guard. I asked her a little bit about, what was it like working as a security guard during the pandemic? What kinds of accommodations did her employer provide her? Did she have PPE? Did she have paid sick time off? And then at the end of the conversation, she said to me, oh, I thought you were going to try to talk me into getting vaccinated. And I said, no, do you have any questions? I'm happy to answer questions. She asked maybe, 2 or 3 questions. And then I thanked her for her time. And then I get a call from my friend who says, well, what did you do? And I said, what do you mean, what did I do? And she had just signed up to get vaccinated. So, I think a lot of times it's less about the facts per se. It's more about these other less tangible things.
And it's interesting to me because this is something that we heard from our previous panel, the last previous panel discussing obesity, is there has to be that sort of empathetic and understand human approach, which makes me think about you have another focus. And I like the way it's phrased as diseases of despair, because it brings forth this element of that humanity. There's an emotional element to this. And I would love for you to talk and explain what diseases of despair are.
So I'm not the one who coined that term. That's Ann Case and Angus Deaton, husband and wife duo at Princeton, who have done a lot of the economic analysis behind this notion of diseases of despair. But that encompasses mental health issues, in particular depression, anxiety, and suicide, opioid overdose, alcohol-related morbidity and mortality, as well as gun violence-related deaths. And what we have seen in the last decade or so is a drop in life expectancy, first among white Americans in rural areas in particular, lower income areas, or people in particular, but we have now also seen that in other racial and ethnic groups. And so what is driving some of that? Some of the hypothesis is that this is really about the decline of things like manufacturing and the economic impacts on some of these communities. But I think it speaks also to health being a lot more complicated than what happens in healthcare or even public health departments. When you see a drop in life expectancy, how are we addressing that? And can a hospital, for example, really solve that problem?
Yeah. It's interesting to me because when you point out these issues, mental health, the opioid crisis, gun violence, these are all issues that are top of mind for a lot of voters right now as we gear up for 2024. How do we make sure, going back to disinformation, that disinformation isn't what's driving voters when it comes to trying to make health decisions or who to cast their ballot for, but rather, again, the facts of things and again, the emotional human element of it?
Yeah, I think unfortunately, some of our own public leaders are spreading much of that disinformation. And I think as members of the media, it's really incumbent upon us to be fact-checking in real time as much as possible and holding people to account as much as possible as these things are being said. For example, has been this cluster of what's being called white lung, which is basically what we as physicians call ARDS, pneumonia among children in China. And very quickly that was being, you started to hear conspiracy theories. Is this the new Wuhan virus? Is this, related to a similar cluster of cases in Warren County in Ohio? And unfortunately, one that has real impacts on people and their fears and reliving sort of what happened during the pandemic. Two, confuses people about what to do and to keep their children safe, right? and I think continues to pollute some of the discussion of these public health issues in a way that's not productive.
Yeah. So then I guess it's a big question. What would you like to see our political leaders, whether that's at the state or the federal level, do at this point in time when it comes to addressing not just healthcare, but the disinformation that is surrounding healthcare at this moment?
I think also it's broader than just healthcare. And I think this is a mistake that we make, whether it's healthcare or public health. We're thinking about it in those silos. It's much broader than that. So, whether it's Ukraine or whether it's, gun violence and what works for gun violence or whatever it is, very often it's the same actors that are pushing out this disinformation in a very coordinated way. And to better understand across some of these issues, industries, how this is being done and to work more collaboratively and not just isolate ourselves to a focus on healthcare per se, I think would really strengthen our ability to address some of these issues.
Absolutely. And doctor, we haven't even begun to talk about, we are going into cold and flu season. Actually, we're kind of already there. There's concerns again about COVID, never actually fully left us, so we know. So looking at everything that's happening, our discussion even today, is there one thing you're most focused on at this moment in time?
Oh gosh. There's so many things to be focused on at the moment. Unfortunately, we just saw that recent shooting in Nevada. And, there have been several more mass shootings just in the last couple of weeks. Some of them in private homes, so they tend to get less attention when that happens. And unfortunately, there are now discussions in Congress about curtailing the funding to the CDC for gun violence research. And for many years, that was not allowed. That was could not be done. And finally, over the last 4 or so years, we have seen that kind of research being funded. And so that's certainly top of mind. How are we continuing coming out of the pandemic to strengthen public health? Unfortunately, I think we did not learn the lessons of the pandemic. And we actually find ourselves in a weaker position than ever should there be another pandemic like we saw with COVID.
Doctor, my final question for you. I do want to hopefully leave with a little bit of positivity taken away from today. Are there things that you're looking at that have been that we've taken positive strides in, things that you're hoping are going to maybe help change the way that we have been doing some of these things?
I do have some optimism about some of the younger folks who are concerned about climate change and are also having conversations about climate change and the impact on health. And I think that is an area, whether, again, you're in healthcare or public health, we really need to be thinking about and getting out ahead of. And so the fact that there are young people who are concerned, who are engaged, I think is optimistic for me.
Dr. Gounder, thank you so much for being here with us today. I appreciate you.
My pleasure.
Thank you to our moderators and to all the amazing guests who joined us today. That brings us to the end of our program. On behalf of The Hill and our sponsors, CVS Health, AstraZeneca, and Novo Nordisk, we'd like to thank everyone who joined us here today and those who tuned in online. If you missed any portion of today's discussion, it will be available on our website shortly. And thank you very much to everyone and have a great day.